ready to perform platelet-rich stroma procedure for a patient. The patient is a 69-year-old lady. She has been suffering from knee osteoarthritis for the last 3 years. She consulted another surgeon in Chennai for possible knee replacements, but she wasn't convinced and she wanted a non-operative solution. So today she is going to undergo the procedure under spinal anesthesia. I'll show you the operating. This is the operating room for the procedure. This is the ultrasound machine. We have two machines here for preparing PRS solution. Two machines here. The boils apparatus, although it is being done under spinal anesthesia in case of any emergency, we'll be monitoring her oxygen saturation and pulse. There's a pulse oximeter. All anesthetic equipment are available. This is the operating table. Watch is there. It will take less than 2 hours for the procedure. Here she is walking into the theatre. Anesthetist has arrived on. Is sighting the Venflon. It's very careful. It has to be done properly without producing any pain. And you can see that he is successful in the first attempt itself. So patients are highly satisfied with attaching the connect, securing the Venflon. Oh.
The paramedian approach is the
Paramedian approach also.
rather than going straight
in
the midline.
So successful spinal anesthesia. These are the equipment and instruments required for the PRS procedure. That is the local anesthetic procedure. Here is another trolley with instruments.
என்னன்னு எக்ஸ்பிளைன் பண்ணணும்.
Now we are ready to inject the SVF. I have positioned the ultrasound probe and you can see the outline of the femur. That is the outline of the femur, and the area above that is the effusion, and above that you can see the quadriceps.
The gap in the this one.
There. Yeah?
Yes, sir.
That's inside the space. It's inside the space. Underneath the pedular tendon. And the
So the hypoechoic space is
அவ்வளவுதான்.
this space.
That space.
Black one, black one.
Okay. Okay. Now we are ready to inject. Abhiram, now hold this with an artery forceps and hold it with an artery forceps. Then the needle. I am going to unscrew it. Now I am ready to inject a PRS solution. Look at that. You can see the
see the joint space distantly. Terida?
Yeah, yes, sir.
Huh?
Increase the hypoaerobic space.
Liam?
Yes, sir.
Done. Suprapatellar injection done. So one knee injection is over. Out. So record. Needle is there. You can see the needle there. Okay. Underneath the thing. Okay. Come. Good. SCF. SCF is ready. You can see the SCF flowing into the joint. Needle Terida?
Yes.
Okay. எப்படி இருக்குது எதுவும் தெரியல வலி இதா இருக்குதா ரெண்டு காலுக்கும் முடிஞ்சாச்சு கம்ஃபர்டபுளா இருக்குதா வலியே இல்ல வெரி குட் எல்லாம் ரெக்கார்ட் பண்ணியிருக்கோம் உங்களுக்கு சொன்ன மாதிரி இப்போ வந்து ட்ரெஸ்ஸிங் போட போறேன் ட்ரெஸ்ஸிங் போட்ட அப்புறம் ஓடுக்கு ஷிஃப்ட் பண்ணலாம் So these are the various holes for the procedure. If there was a knee replacement, the incision would have been so big, such long, 6 inches long. But now this is done through very small puncture holes on both the legs. And that's it, no incisions. Now that was the ultrasound guided injection of PRS into both knees. The procedure is completed. These are the dressings at the end of the procedure. The patient felt no pain. You would have seen her reaction. And that concludes the procedure. You have seen the small tiny holes for the procedure. And that's it. So PRS is an excellent treatment for osteoarthritis of both knees. If you have any relatives who are suffering from osteoarthritis, and if you happen to see this video, refer this to them. Like this video, subscribe to my channel, Madras Joint Replacement Center, and see you in the next video. Cheers.